YouTube is now live. Let me get the camera situated. Oh, hold on here, Chief. This takes a minute. I apologize if you are watching this as a replay and thinking, what is going on? I normally schedule these as a YouTube event, but something happened and I either didn't do it right or it got deleted, so I apologize. Hopefully that thing will stop rocking back and forth. Okay. All right, guys. Oh, we're going to get started in just a second here. I need to start the Facebook Live also. If you are just now joining, my name is Ginger. I am the Pain Warrior Princess. You can probably see if I move that down. My little fleece here. I am a chronic illness patient, and I have decreased immunity. And I am coming on here live every day to discuss COVID-19 news that came out today. And I am doing two cameras, so if I don't look right into that camera, I apologize. I'm trying to do two things at once here, so pardon me. All right. This is the first time I've used just Streamlabs, so forgive me. I'll figure it out as I go. All right. Now I'm going to get Facebook going. Right, gonna get Facebook going, right? All right, so give me just a second there, YouTube. We'll get going. Waiting for Facebook to respond. Not sure if I'm live on Facebook or not. Does not appear to be, but Facebook has a new interface as of today that I did not know of, so I'm going to go online on this phone and see if this is broadcasting because it's spinning. I have no idea. Okay, wait. I think I might be live. Let me just double check. Okay, if you are on Facebook, there was a new interface on the Facebook Live when I logged in, and I can't see myself to know if you can see me. So we're going to use another phone and see. Okay, yeah. Looks like I am live. All right, but I can't see myself, guys, so we're going to have to fix that real quick. Bear with me like 2 minutes. This is the first time, like I said, I use this new Facebook interface, and I want to make sure that I'm doing it right. So just let me install Facebook on this other device, and then we'll get going. I apologize for the technical issues. I think I'm doing it right. I'm not sure. I did mean to share my screen. Lots of messages here I got to get rid of while this other thing is downloading on the other device. And it says 100%. Now we're waiting for installation. I'm so sorry, guys. Like I said, Facebook changed the interface. I have no idea if anyone is watching right now or if you can even see me because the I can't look at myself, but I am sharing my screen tonight, so I will explain that while this is trying to install. The reason I'm doing that is because there are some sources that I wanted to share with you, and a video that I got permission from someone to share. If you remember the other night, I mentioned that there was a woman in Philadelphia who had to get a COVID-19 test, and she went through the drive-thru to do it, and she made a video kind of showing the process. I'm not sure why this is taking so long, but this is an old phone, so that might be why. But yeah, she did a video and showed the process, and I don't know if I can like not share my screen now so I can see what's going on and then share it again, but obviously I'm gonna have to do like a test run live sometime tomorrow and just make sure that I know what the heck I'm doing, because right now it doesn't seem like it. So I am waiting for the other phone to get me on Facebook so I can see what you guys see. But yeah, I am sharing my screen tonight. If you are new here, my name is Ginger. I'm the Pain Warrior Princess, also known as. And let me log in here, and then we can get moving. I mean, geez, and I apologize for being late tonight as well. Clearly from the technical difficulties that I've explained, you can tell. Okay, why won't the keyboard work? Wow, it's like, it must be something with me. Okay, here we go. Okay, let me enter my password, and then we are going to make sure that what I think you can see, you can see. Okay. No, I don't want Facebook to access my area. Thank you anyway. Okay, so let me check and see what this video looks like. Ay, ay, ay. 3.5 minutes, huh? Okay. Okay, so you can't see me at all. You can only see the screen. Okay. Make sure. All right. That what I think you can see, you can see. I just made a change. Let me see if it worked, because now I can see me, but I'm waiting for the app to catch up. Area. Thank you anyway. Okay, so let me check and see what this video looks like. Ay, ay, ay. 3.5 minutes, huh? Okay. Okay, so you can't see me at all. You can only see the screen. Okay. I got it fixed. I'm pretty sure I did, but I'm going to glance over here to make sure. I can't see anybody who is on right now doing the live this way, and I don't like that. So if you are here, drop a comment. This is a very strange interface. So yeah, all right. So I am going to share some things on my screen with you today. Trying to get positioned so YouTube can see me all right as well. And let me just start by saying, everybody who reached out to me and said, are you sure you're okay? Are you sure it's a sinus infection? It's not COVID-19. Thank you so much. I appreciate everybody's good wishes and stuff. I am 99.5% sure that it is a sinus infection, just because I have had them before. I'm very familiar with them, and the way that how I'm feeling progressed is how my sinus infections have always progressed in the past. Of course, in the back of my head is this whole COVID-19 thing going around, so it's in the back of my head. I am carefully watching it. I do have a fever, very low grade, like 99.4. I had my telehealth appointment today. Got 10 days of antibiotics for my sinus infection. And by the way, guys, there are little things that we can do to help our country in this situation. One of them is what I did today. I was very clear in my telehealth appointment with my symptoms, with the level of my fever, and that I've been self-isolating, and I've only gone out for 30 days, and I've only gone out less than a handful of times in a month. I really wanted to make sure that the PA who helped me today had all the information ahead of time. How does that help them? Well, it saves them time. It saves them from having to ask you, have you been out? Have you been self-isolating? Do you think you've been exposed? And probably 10 other questions that they would ask. So just a recommendation from me. Now, there was another thing as well. After she realized that I've had sinus infections before, and we went through all of that, she said, what antibiotic did you normally get? And I said a Z-Pak, but that's azithromycin. You've all heard azithromycin in the news. That's needed elsewhere right now. So I said to her, if you think another antibiotic would work, I am fine with that. I don't want to take that resource, because we need all that we can get to treat people who are COVID-19 positive right now. If their doctor chooses to give them that. So she said, no, really, it's okay. We can do that. And I said, you know what? For my conscience, I don't want to. So again, that's not me patting myself on the back. That's just me giving you two little examples of how you can help in a small way. If you happen to be a patient right now and you have a doctor's appointment, get kind of all those questions out of the way at first. And then if the doctor needs to know anything more about your possible exposure, they will ask you. And then if there is another drug that would work for you besides that antibiotic that is needed right now, especially in New York City and Los Angeles and Washington State, maybe consider that. So, okay, now let me open my notes, because I want to real quick talk about what we're going to talk about tonight. Kind of a rough press conference from New York State today. I'm not going to lie, it was rough. a lot of notes from that. I'm going to try to go through this stuff quick, guys, because like I said last night, and it's not any better now because I haven't started the antibiotics yet. I'm not really feeling that hot. I still do have a fever. I have a bad headache, but I committed to do this, and there's a lot of news to share. There are some other resources I wanted to share. So we're going to go ahead and move forward with it. So if my phone would stay on, you know what? Oh, goodness. Have you guys ever had days like that where like everything that you touch that's technology, whether it's the dishwasher or your phone or your computer, it like has a conniption. It just doesn't work right. I have those days, like all day it's like that. And I know that sounds very much like user error, but I don't think it's an error. I think it's some kind of frequency that my body is sending out. Okay. All right, so yeah, tonight we are going to go over some of the information from the White House press conference and the New York State press conference. There was also a virtual town hall that was earlier today. And if you have time, I encourage you to watch it. It's from midnight to 2 in the morning Eastern time. DVR it. I mean, you're supposed to be staying at home, not working, so maybe you can stay up or working from home. Maybe you can flex your hours. But it was pretty interesting. And there was a bit of information there that that kind of set the record straight about something that Governor Cuomo said. But we'll go through the press conferences. A little update about my health. I kind of did that a little bit. So I don't think I'm going to say anything more about it. Just, I appreciate you guys being concerned about me. Again, I'm pretty sure as far as person-to-person transmission, I haven't been exposed. Like I said, a month at home, less than 5 fingers how many times I've been out in a month. Very careful when I do go out, taking every possible precaution they have told us to, and then some I invented myself. Like taking I can't say this word, rural roads as far as I could to get to my pharmacy, and then the air conditioning, I didn't let air come in from outside the car. I just circulated it. I made those two up. But the point is, I'm doing what I can. So, all right. Hold on a second here. Okay, so yeah, we're not going to go over that again. I think I covered what I was just trying to say, but again, fever, this brain is not fully engaged. Oh, yes, I do. I'm so sorry. So yeah, person-to-person transmission, I'm pretty sure I've not been exposed. Community spread, that's, you just don't know. But with how careful I've been and how careful I've always been with hand washing and sanitizing, I think I'm okay. Right. So I'm going to start a new segment. So today we're going to start today's item to sanitize and add to your high touch list. There are some things that you might not think about to sanitize at this time. So we're going to talk about that. I have IA bottle trick. That means isopropyl alcohol bottle trick. I figured out something that would maybe make it a little bit easier to use it. So we'll talk about that. Also, I'm making 2 lists of resources to share with you guys. One is a list of the links, or a list of the posts that I have put up about COVID-19, like what the subject is, and a link to it. Because a lot of people are messaging me and saying, hey, somebody said this started in November. What do you say about that? And I have a post about it. Or somebody said, these people are selling face masks and I don't know if they're antiviral or not. There's kind of a post about, you know, buyer beware kind of a thing. So I'm putting that together. Another resource I'm putting together, and I'm going to see how fancy I can be now and share my screen. Yeah, no application window, please. This one, share. And that would be this. I think there's a slight delay, but it's a resource list for official information. Some of these links I'm going to click here pretty soon, and we're going to go over and look at some information from them. And this is something, again, that I'll put together over the next few days and publish. Most of the information will focus on New York State and on Arizona, because New York State is the hardest hit. I have family there, of course, but it's the hardest hit area. Arizona is where I live, and then of course federal information. So I will click back over to this shortly, but let's get my beautiful face back on the screen, and then we will start going through the press conference information. Again, I apologize, guys. New interface with Facebook Live, and I am figuring it out as I go. Okay, from New York State. Ding. Oh, Richard. Huh? Oh, if you're watching, thanks, David. I'll look that up later. Okay. Right. So the New York State Press Conference. New York State has been the hardest hit, as I mentioned, and just looking at worldwide in the U.S. before we look at that. I really wish that I would have typed these numbers in because it's much easier. I will do that tomorrow. Somebody pointed exactly what you stated out to him. Okay. So I will actually type these numbers in tomorrow because me rattling off numbers, that doesn't really mean much. I mean, it's like 20 numbers in a row, and unless you can see them, doesn't mean anyway. So I'm going to rely on my marketing research analyst background, do some charts and stuff like that. Nothing complicated, but just so you can see the magnitude of what's going on. But there are over 422,000 cases worldwide, almost 19,000 deaths, and as of today, now it was about 2:30 GMT time tomorrow. So of course, some parts of the world it's tomorrow, and not here yet. So the recovered number so far, 108,879. Now a couple days ago, there were 80,000. Remember, I talked about that. So that's good. All right. Now, so remember I said yesterday that Governor Cuomo had asked Mayor de Blasio for a plan of how they're going to handle New York City because of the density of people, because there are still people hanging out in parks. There are still people that are not really taking this as seriously as they should. So apparently that was supposed to be into him by noon today. We'll find out in the press conference tomorrow if it was, and I'll let you know. I kind of went off on de Blasio last night. Again, I wasn't feeling good. I was kind of frisky. Not feeling a whole lot better today, so we'll see. We'll see how this goes tonight. You know what? Hold on one second. Let me ask him to stop messaging me because I'm doing a live. I'm live right now. Let me get back to you later. Okay. New York State right now is doing the highest level of testing in the country, and that makes sense because they are the hardest hit. There are a couple other reasons why that makes sense and why they are the hardest hit, which I'll talk about in a little bit. Let me open my notes again. Okay. I just want to make sure if I had a note written about something that I wanted to mention that I did. Okay. He also said that they'll be using hotels if needed as like makeshift hospitals. And I said that like a while back. Remember, I kind of went on a little bit of a rant with Cuomo, at Cuomo before I kind of started to realize, okay, yeah, he's really doing a great job. But yeah, I think it's a great idea. And for all the reasons I mentioned in my post, he didn't say they're going to start doing it yet, but basically whatever is at their disposal to treat patients is what they're going to use. So if you're interested in that post about, you know, using hotels as like makeshift hospitals, you can find that on my feed. I'm going to tell you now, you're going to scroll a lot, but when I get that resource list done that I mentioned to you, it will be on there. But if you want to see it now, just go to my feed and scroll. There's also a link to an article in there about, I think it was Best Western Hotels. Why did it end? Oh my goodness. Okay, all right. Let me start this again. I don't know what happened, but it ended. I don't know how to use this thing. All right. This is really obnoxious. I'm just saying. I need this. Guys on YouTube, I am so sorry. I don't know why Facebook kicked me out. I really don't. But they did. So now I have to go back in and do it again. Just trying to get too fancy, I guess, with sharing my screen and stuff. Okay, I want to go live. Let me go live. Why am I leaving a site? What are you talking about? Okay, we're going to try this again with Facebook Live. I'm sorry, YouTube, just bear with me. Technical difficulties. Ay, 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 ay. Sorry, guys. Say something about this live video. I am trying. Okay. Okay. Control C. Okay. Share to your timeline. Camera. Stream. Viewing. Go live now. Okay. I hope that I am live again now. Okay. All right, we're gonna try this again. I'm sorry, people on Facebook. I'll give you a minute to come back on. I don't know what happened. All of a sudden, I got a message on my screen that says your live has ended, and it's barely started. So I don't know what happened. I don't like this new interface. I don't know if it's something I did or they did or what, but it could be my machine here. So I'm going to close as many tabs as I can. And hopefully I will stay up live this time. I am so sorry, guys. Again, this new interface is not fun. Okay. So let's go back and see if the live I just started is actually going. It says it's live. But there we go. Okay. All right. I think I'm back on. Okay. Again, guys, I am so sorry. I am so sorry. Let's get back to what I was talking about. So New York State, the hotels. If you want to see that post and see that article about Best Western in the UK using their hotels for the purpose of treating COVID-19 patients, you can find that on my feed. Let's see here. What's next? You know, Cuomo was complaining about the federal government has to prioritize resources, and they really are. I don't know what the point of that was, but in New York State, there are 25,665 cases, and it is doubling every 3 days. So it's really imperative that people do the precautions. We're on day, 8 or 9 of 15 days to stop the spread, and guys, we have to keep doing it. We can't get COVID-19 fatigue. We can't assume, okay, well, it's safe to go out today. We really have to keep doing this, guys. Or like I said the other night, it's going to be way more than 15 days. There are a lot of people in New York. In New York City alone, there's almost 15,000 cases. When I looked at the number before I came on, it was 14,904. And I guarantee you by morning, it's going to be probably 16,000 at least. So it's really important that we keep doing those things that we are supposed to do. What's next? But I'm trying to look and see if this thing is still working because it's hard for me to tell. But let's just assume that it is, and I will continue. Trying not to use bandwidth because I don't know if that's the issue or not. As much bandwidth. I need to use bandwidth. Okay. Sorry, guys. Technical issues, not feeling well, feverish. Not a good combination. Okay, now in a minute, fingers crossed that the live cooperates, I'm going to put up some information about cases in the New York metro area, the numbers worldwide, the numbers in the U.S., that video about the drive-through testing that a journalist in the Philadelphia area did, and a KTAR story. KTAR is a radio station out here. I'm sure by now you've heard the Arizona man who took chloroquine phosphate. It's not the same thing. A lot of people don't understand that. They don't understand that they're not the same. They're not interchangeable. They're not the same ingredients. So anyway, tragic story, but a very good lesson for everybody. he did not follow. He wasn't diagnosed with COVID-19. He didn't get a prescription. He got it. It's an aquarium cleaner. So I'll put that story up, but I'm sure by now you guys have heard it. So New York, he said, we have 10 times the problem California has. And to me, not quite. That's a very scary thing to hear. And I want to explain why not quite. 100% of people who are diagnosed with COVID-19 do not need to be in the hospital, in the ICU. In fact, most of them do not. In New York State, remember I said there were 14,904 cases as of now. Now, earlier this morning when Governor Cuomo gave his press conference, he said there were 3,234 hospitalized. So you can see that's not even close to the total number of cases. There are 756 in the ICU. So when somebody with COVID-19 is hospitalized, it's bad enough that they need the ICU. And it's 23%. So yesterday it was 24%, if you remember. So it's getting better, slowly, but it's getting better. So, excuse me, I misspoke. I am so sorry. Of the 3,234 hospitalized, 756 needed the ICU. That's 23%. I misspoke when I said anybody who's in the hospital with COVID-19 is in the ICU. I completely misspoke. Please forgive me. Again, I don't feel well. I apologize. Totally my fault. And I hate doing that because I want to give you guys accurate information. And I would kick myself in the ass, but I'm sitting cross-legged, so I can't do that. Okay, the problem is the volume. Yeah, it's the highest and the fastest rate of infection New York State is. There are a couple reasons for that. If you're not familiar with New York City and the New York metro area, other than the population density, there are millions and millions of people who live in New York City and the New York metro area. Also, there are 3 international airports in that area. There's JFK, there's LaGuardia, and there's Newark. So all these international travelers were coming in from all over the world, certainly some from China. And unfortunately, they didn't know that they were infected, or if they felt sick, they didn't know what it was back then when they came in. So this is part of why New York State has such a big, the highest and fastest rate of infection. And this is another reason why we really have to do those precautions. If you're in New York State, you really have to do it. Now, there were some people who they think were in New York City, and then Sunday before 8 o'clock, they hightailed it out to Westchester County or Long Island or New Jersey or somewhere else. So what that means now is if they were carrying COVID-19 and they were asymptomatic and they went to Westchester, Long Island, New Jersey, they brought the infection with them. So now the problems in those 3 areas are going to get worse. So what they're recommending, what they're asking, and what I am begging is that if you were in New York City and you left before the Sunday at 8 things started, where only essential people are out, please quarantine, self-isolate for 14 days total from the time you left the city. So like Dr. Burke said, if you left 4 days ago, please quarantine yourself for 10 days. I mean, 4 days have already passed. There's nothing you can do about that and the people you came in contact with. But what you can do is the next 10 days, be responsible, quarantine yourself. Okay, next. So there was something that Governor Cuomo said that I hope is wrong, and here it is. It's a direct quote. He said, what happens to New York State is going to wind up happening to California and Washington State and Illinois. It's just a matter of time. Now, I hope that's wrong, but one way that we can make it not be as bad as what New York State is dealing with is to do the precautions we're being told. I haven't even mentioned wash your hands yet today, but you guys know that. Wash your hands, sanitize your hands if you can't wash them right away with hand sanitizer. Clean your surfaces. Social distance. Don't go in big groups. Pay attention to what your state and local government and county government is telling you. I'm not in every state. I don't know exactly what everyone in every state is supposed to be doing, but make sure that you're doing it if you are in a state where you're not supposed to be going out. If we do that, then we can help prevent the spread of this. So California, Washington State, and Illinois don't have the same level of infection as New York State. Now, there is a bit of an issue with New York. And I think I'm going to jump to that now because I know a lot of people maybe haven't been to New York City or maybe don't know like the geography around there. So I wanted to kind of explain it a little bit. New York City, in the metro area of New York City, it borders with New Jersey. Connecticut is not too far away. Pennsylvania is not too far away. In fact, Connecticut is so close. When I was in college, I went to visit a friend in the Bronx, which is, of course, you know, is a borough of New York City. And Connecticut was so close that that's where we went out to a club for the night. So it was a very short distance. This COVID-19 doesn't respect state or county lines or city line, like borders. It doesn't care. So that's part of the problem with Metro New York too, is that all these other states are going to be affected. And what makes that so difficult is that every state has a governor, every county has, you know, officials, and then it goes on down the line. So it's a very serious situation in the New York metro area right now. I would really like to be able to show you the tab that I wanted to open that I think kicked me off the live, but I'm going to try it again. Let's see here. Going to try it again. All right. Pray for me. Share the screen. Application window. Let's see what happens. You're sharing your screen. Thank you. I know. Okay. Let's go here, and I'm going to see if I can pull up that map of the metro area. I need my mouse, and I need to right-click and not do it that way. There we go. All right, are you still with me? I think you're still with me. Okay, that's actually the wrong one, but at least a link open, so that's a good start. All right, let's go back because I don't want to have this thing tank on me again. Sorry for the technical issues, guys. It's just, that is the type of day I'm having. Okay, Daily Voice. Click on that. Open up. Let's hope it worked. The little window they give me to actually see what's going on is so tiny. I can't see what's going on. Okay, we're just gonna roll with it. And if this live comes out as bad as I feel like it is, I'll just delete it. Okay. Scrolling down here. Now, YouTube, I know that you can't see this, but I will put the links in the description when I'm done. Now, for some reason, this stupid pop-up window came up that didn't come up earlier, or I would have kept the tab open. Okay. So what is on the screen, if it would stop scrolling around? Okay. Let's see. This is basically the Metro New York area. And you can see kind of here around the middle, like here you can see Philadelphia. Here you can see New Haven, Connecticut. This is Long Island, of course. This is New Jersey. So you can see how very close all of these places are and why it's so important for everybody to do their part so this thing can get under control. I really hope you guys can see this screen. I don't know, but I'll tell you what, if this doesn't come out right, I will share the information some other way to make sure you guys have it. I appreciate your patience. Again, I apologize. So what you could do with this, and this is again going to be on my resource list, is, okay, let me see Westchester County. Can zoom in and find out number of cases and stuff. That's not as important as this thing not being so big anymore. Let me go back to that one. That's a bit easier to read. Okay, so I can't tell if you guys can even see what I'm doing, and that's frustrating me. Appreciate your patience. Again, I apologize. So what you could do with this, and this is again going to be on my resource list, is, okay, let me see Westchester County. Okay, so I have just verified you guys can't see anything that I'm trying to show you, but I did say share screen. So I don't know what I have done wrong. I apologize. But what I can do is kind of explain to you what it is, okay? So you have New York City, and then right here is New Jersey. Sorry, New York City. It's not shaped that way, but you get the idea. New York City, and then you have New Jersey, and then you have Pennsylvania, and then you have Connecticut, and then Rhode Island is up there, and that. So my little makeshift demonstration, you can see they're very close together, and like I mentioned, with the state lines, the county lines, and all of that stuff, it's going to be imperative for those governors to work together. And I'm not saying they're not, I'm just saying they will need to do that to get this thing under control. We did talk last night just a little bit about, you know, the economy, and that is important, yes, but if people aren't alive to enjoy the good economy, or if there are not workers who are healthy and able to work to keep the economy going, then there wouldn't be an economy anyway, a good economy anyway. So that's why we have to do what we have to do right now, get our country healthy again, get this virus to go through its cycle, hopefully go away and never come back, and then our economy will recover. That's just something that I'm sure will happen. No, I'm not an economist, but every indication before this says that the economy was good. So when this is over and we repair our people and our companies and everything else, it will come back. I don't know how long, but I know it will. Another thing that Governor Cuomo mentioned was, oh, now I have hiccups. I hope they go away. FEMA is sending New York State 400 ventilators, and Cuomo said, I need 30,000. In fact, at the end of the press conference, he said, you know, basically, what am I going to do with 400 ventilators when I need 30,000? You picked the 26,000, and he got really mad. You picked the 26,000 people that are going to die because you only sent 400 ventilators. Okay, well, let me kind of bring it down a notch and put it into perspective. Those numbers are based on projections and models, not scientific data, because there is no scientific data because this virus is so new. So that seems to be worst case scenario kind of thing. Just like when they were saying, look, 40 to 80% of New York State will get infected with this. Now remember, only about 1% actually succumb to COVID-19 and they don't make it. So even if 40 to 80% of New York State gets infected, yes, it will hurt the economy. Yes, they will be sick. Yes, it will not be fun, but they will recover. And when he says 26,000 people that are going to die, I don't know. I don't think that was a nice thing to say. I think it was a scaremongering. And besides that, we found out later at the virtual town hall that I mentioned is going to be aired later tonight. They mentioned, you know, President Trump mentioned that, I want to make sure I get this accurate. In 2015, Governor Cuomo refused to order 15,000 ventilators for a pandemic. Now, there wasn't a pandemic back then, but it was to prepare just in case. He rejected the order. He rejected the offer to order them offer, it's not like they were going to be given to him free, but he rejected the possibility of ordering them then. 15,000 ventilators. He rejected it. Before I tell you the next part, let me explain what they're trying to do in New York, okay? They're trying to take, one of the things they're trying to do is take one ventilator and have 2 patients on it. So I don't know if you've seen a picture of a ventilator, but like we talked about the other night, it brings oxygen into your lungs and it pulls out carbon dioxide. So they're trying to figure out if they can have one ventilator between 2 patients and just 2 sets of tubes coming out. So by my calculations, if they can do that, they already have some ventilators in New York City or New York State, then FEMA is going to give 400. And if they can make 2 patients on one ventilator, that's 800 patients they can take care of that way. Had he ordered the 15,000 ventilators in 2015, and I'm not blaming him, I'm not shaming him, nobody could see that this was coming. Nobody, I mean, I know somebody's going to say, well, this doctor did, blah, blah, blah. Fine. But this was not on the horizon. This was not even something that anybody really thought. I don't know. I have to be careful what I say because there's always people out there waiting to correct. But the point is, it seemed, okay, let me put it this way. It seemed like such a small, minuscule possibility that anything like that would happen, that even though he could have gotten 15,000 ventilators at a very good price, it just didn't seem like it was anything that they needed. That's just the fact. And the other part of it, while he kind of ranted and said, you tell me which 26,000 people are going to die, or you tell them, he established death panels and a lottery instead. Governor Cuomo did this, so he didn't buy the 15,000 ventilators. And again, I'm not bashing him. It's just the idea of having a pandemic of this proportion or of these proportions was such a remote possibility that nobody ever thought that it would happen. So when the ventilators were not bought, when the death panels and the lottery was created, nobody ever thought it was going to need to be used. And I'm not saying now that it will need to be used, but I'm just saying there's kind of 2 sides to this story. Now, let's do the math. So 800 potential patients can be treated from the 400 ventilators that FEMA is sending. They already have some ventilators in New York State. Had the 15,000 or it was either 15 or 16,000. They actually said both numbers. Had they been bought, that, and they can do this 1 patient or 2 patients, 1 ventilator, that would have been 30,000 patients right there that they could take care of. I'm just saying, I want you guys to get both sides of the story, because when I was watching the New York State Press Conference and Governor Cuomo was talking about that, I was like, wow, like wow, what is going on? But the governor didn't do something 5 years ago that maybe could have made it so this wouldn't happen. But again, this just tells you how serious it is, and how vigilant we have to be to try not to get COVID-19, to try not to have another pandemic. Well, we already talked about China. I'm not going to go into that again. We're not going to go into that again. Okay. Let me see what else I wanted to cover. Right. Somebody was mentioning that they didn't think the marijuana dispensaries were essential. I saw that like on the news before I came in here, but just to clarify, if you're not if you're not a medical marijuana patient, you're not familiar with medical marijuana, you're not in a recreational state, a lot of people use medical marijuana or just recreational marijuana as their medicine. They prefer a more natural medicine such as that, or it works better for them. In any case, because New York State has a medical marijuana program, and because Arizona does, and many, many other states do, I personally believe it is essential. Of course it's essential. It's somebody's, well, in our case, I think over 100,000 somebody's in Arizona's medicine. So yes, it is essential. Let's see. I'm just trying to run through this real quick, guys, because I really want to jump off here, but I have a lot more I want to talk about. They do think that a lot of people have had COVID-19. It's self-resolved. They think maybe 80% of the cases are like that, and then 20% are where they need more medical care. So that's kind of encouraging. You know, like they've been saying all along, the majority of people who do get COVID-19 will have either mild symptoms, be asymptomatic, or have symptoms that they can handle at home. Once they know what it is, of course. And then they can quarantine themselves and all of that. Okay. There was another thing that he said that I just quickly want to mention. They were talking about the Defense Production Act, and I'm sure you've heard about this the past few days. Basically, that is an act where, like, if I own a company and I make, I don't know, if I make washers and dryers, whatever, and once the Defense Production Act is, you know, I can't think of words tonight. I really don't feel good. Basically, what happens is the government would call me and say, hey, we need ventilators made. You need to make them. There's more to it than that, but that's the idea. And Governor Cuomo said, you know, no one is going to make 40,000 ventilators right now voluntarily. They don't know that someone is willing to buy them. Well, you can't, on one hand, complain that the ventilators are so expensive and you can't find what you need and the government won't send it. And then say, well, no one's gonna make them unless they know they're gonna be sold. By your own calculations, you would buy 30,000 of them. So why are you saying that? You alone, if somebody made 40,000 ventilators, would buy 30,000 of them. You need them. So unless people rent them, I don't know if they can be rented, but who knows? All right, so Matilda's Law in New York State, you guys can look that up if you want to. It's basically, if you're 70 and older, you have a compromised immune system and underlying illnesses, you're supposed to stay home. Visitors limited to immediate family and close friends who need emergency assistance. And the visitors should be pre-screened, make sure they don't have a fever or any symptoms, especially the fever part. Because remember, people can be asymptomatic and still pass it around. And both parties should wear masks. So the visitor and the person who is at home following Matilda's Law. Okay, let's just quickly run through some of this stuff. They don't know for sure if there's going to be this season of COVID-19, then it's going to go away, then it's going to come back. They don't know that for sure. But what they are trying to figure out is, remember we talked, I don't know, early on when I started doing the lives about why this strain of coronavirus was so dangerous, because the RNA, the genetics of this strain kept changing. And it changed so quickly, the scientists couldn't follow it in the beginning. It can still mutate, but this is what Dr. Burke said. Okay, that's my source. But certain parts of the RNA, of the genetic code, stay constant. And if you've already had COVID-19, then your body has produced effective antibodies. We talked about antibodies the other night. You produce the effective antibodies against COVID-19, so you should not get reinfected. That's what they're saying now. I know it's not a definite either way, but they are hoping that it is seasonal. And they are working on some stuff in case it comes back, like prophylaxis, which means we're going to try to prevent you from getting this. So like a flu shot is a prophylaxis. Yeah, okay. I just don't want to miss giving you guys any interesting information, but you guys see my notes every day, like... Okay. The Surgeon General... remember, they are doing a lot more tests, and yes, the numbers of positive cases are going up and up and up, but still, 90% of the people that are being tested do not have COVID-19. I know when you hear, oh, 10% of people tested have it, but remember, the other side of that, 90% don't. So that's good to remember. And of course, like I talked about a few minutes ago, the Surgeon General reminded us that 98 to 99% of people do recover. They also talked a little bit in this, this actually wasn't the press conference yet, it was the virtual town hall that I mentioned. Dr. Birx, I think, was talking about this. There's been some mention of the self-test, the self-swab. Let me just kind of clarify that a little bit. It is not a test that you do at home. It's a test that you would do, if I understand correctly, either like at the drive-through testing centers or at the hospital or some kind of facility like that. But basically what it is you would go there. They would give you a test kit. Inside of it is going to be like a cotton swab, long cotton swab. Not a double-ended one. I forgot what the single-ended ones are called, but whatever. I'm sure you've seen them in your doctor's office. And then you would swab your own nose. Then you would put it into a test tube, close it. Then they would kind of hold open a bag. You would drop your sample in the test tube into there, and then seal it, and then that's it. So you would swab yourself, but it is not a home test. Yeah, that's, I just said all of the next 2 lines of my notes, and I didn't even realize that I would go through it that quick. Okay, so Dr. Birx talked about the case attack rate, and what that means is people who got the virus. In New York, in the New York metro area, in New Jersey, close to New York City, it's 28% plus. In the rest of the U.S., it's way under 10%. So even though these numbers that we're hearing coming out of New York State and New York City and the New York metro area are very, very, very high at 28%, it does not mean the rest of the U.S. is going to be at 28%. And while we don't have a huge amount of data, we do know that the places that are being tested now are coming in at less than 10% positives. So keep that in mind. Remember, we just talked about it means even if it is 10% positives, 90% are negative for COVID-19. So I know those numbers out of New York are scary. That's why I keep going back to it, because I know it's overwhelming almost. But we have to remember the other side of it too. So even in that area, the 28% are coming back positive. That's what, 72% that are coming back negative. Okay, let's move on to the White House press conference. Again, I don't, just to reiterate, I know I said it last night and night before, both probably. I don't get into like the stimulus bill they're working on. I don't get into the financial kind of stuff like that. And the reason I don't get into it and similar things, first of all, that's not my specialty. Second of all, it keeps changing. Like one day it's $1,000 per adult, $500 per kid, and this and that, and it's going to be a check sent to you, and then it's direct deposit from the IRS, and then it's $1,500 per adult. Then it's they keep changing it. So I do not want to come on here and say this is what's going on, because I can't guarantee that you guys are going to watch every single night, and you might hear me say something, even though I'm just passing the information along from a trusted source. You might hear me say something and then kind of be depending on that. So I don't want to do that. When all that is said and done, yes, I will. I'm also not talking about the numbers of gowns and masks and booties and all of that stuff that's being sent out. First of all, the numbers are completely staggering, and it's hard to even comprehend how much, but they are being sent out. I guess that's an important point to say, because a lot of people are saying we don't have PPE, we need it. It is being sent out all over the country. Again, we have to go where the need is the greatest. New York State, especially the New York City metro area, California, Washington State. Okay, so Dr. Birx, listen to the number of tests that have been done. It's unbelievable. 370,000 tests have been done. 220,000 in the last 8 days. South Korea took 8 weeks to do that same amount. So the people who are saying we need more testing, blah, 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 yes, okay. I'm not going to say that we are 1,000% good with that, but from where it started to where we are now in terms of numbers of tests, people getting tested, getting the test results back, that's pretty amazing. 220,000 tests in the last 8 days, which is more than which South Korea took, let's see, 8 weeks times 7 days a week, 56 days to do, and we did in 8 days. That's pretty damn good. Now, she did remind us that there is going to be a disproportionate number of new cases until the backlog has gone through all the labs. There will be shortly a 24-hour turnaround in the labs. So all these high numbers that we're seeing come out every single day, soon the labs will be caught up and we won't be seeing numbers that high. So please try not to panic, try not to get really scared when you see those high numbers. It's just the backlog in the labs getting put through. Okay, we talked about the self-swab not being a home test. Okay. 56% of all new cases in the U.S. are in New York City. Let me say that again. Or New York City and the New York metro area. 56% of all new COVID-19 cases in our country are in New York City and the New York metro area. So that's why it's incredibly important too, especially if you're in that area or New York State or the areas surrounding there. Please stay in like you're supposed to. Wash your hands, do all the stuff you're supposed to. That number, I don't want to say it scares me, but it woke me up. Like that's a big number. All right. And unfortunately, almost 1/3 of the people who are succumbing to COVID-19 in the U.S. are also in New York. I don't think New York City, I think it's New York State is what she said. Normally I write NYS if it's New York State, NYC if it's New York City. In any case, that's a very sad statistic. So my heart and my prayers and my thoughts go out to everybody in New York, the entire New York metro area. Please stay safe, do what you're supposed to, stay healthy. All right. Dr. Fauci came on too. He was talking about testing again, and he talked about a containment window in the hardest hit areas. Basically, right now, we're in the containment window right now. And what does that mean? Well, that means that we have to try to make sure that COVID-19 does not cover the entire country and infect us and infect so many people. I guess that would be a good way to put it. So we couldn't stop the virus from coming in, but we can at least contain it. And that's, again, I'm hammering it home. That's why we have to do all these things we're being told to do. Dr. Birx mentioned again, if you left New York City, you must isolate and quarantine yourself for 14 days. Unfortunately, they are seeing more cases in Long Island, probably because people left New York City before the Sunday at 8 p.m. order. I have family on Long Island I haven't heard from. I've sent them messages. I haven't heard from them. I don't know what's going on. But I do know that if you've left New York City, you really need to self-isolate and quarantine. Seriously. I know it sucks not being able to go out unless you're an essential worker, but what's going to suck worse is if you get COVID-19 and it hits you hard. On the way to the pharmacy to get my antibiotic for my sinus infection today, on the radio they were talking about a 25-year-old, very healthy, lacrosse-playing young man who is having horrible issues, was in the ICU. He had to be moved to another hospital. And his mom was on, and she's not sure that he's going to make it. So this is not just something that attacks older people. This is something that can attack anybody. Most people will recover, like I said before. I don't want it to sound like I'm scare tacticking or scaremongering, but that is something that I heard, so that's scary. All right. Well, something I mentioned the other night too, giving these medications that they've been talking about to people who are COVID-19 positive. They're kind of doing a clinical trial and gathering all their data at the same time that they're treating these people. I'm sure you've heard about clinical trials and people talking on TV, depending on what station you are watching, that our president was touting these drugs as safe, but this idiot took aquarium cleaner, and because it sounded somewhat similar to these drugs. So it's exciting that they're able to do the clinical trials and the data while they're treating people. This is something that the FDA is allowing right now for this. So, okay, another thing that they talked about is monoclonal antibodies. So I looked this up. I was kind of familiar with what it was, but I wanted to make sure that I got the verbiage right. Okay, I can't show Lucinda's video, so I'm going to have to save that for another night. Monoclonal antibodies are lab-produced molecules engineered to serve as substitute antibodies that can restore, enhance, or mimic our immune system's attack on the viral infection, in this case COVID-19, or if it's cancer, against cancer cells. The monoclonal antibodies are designed to bind antigens, which I'll say in a minute what they are, designed to bind to antigens that are generally more numerous on the surface of viral cells than healthy cells, or virally infected cells, whichever it is. So antigens, the antigen in this case is COVID-19. So these monoclonal antibodies are designed to bind to the COVID-19 cells and get the body to produce an immune response and produce antibodies to get rid of the COVID-19 infection. So that's what that means, in case you were wondering. Okay, see phone. That was my note. See the phone, because that's where I put exactly what that meant. Okay, yeah, I already mentioned that I'm not going to talk about the specifics of any of that bill or the relief thing until it passes, just because they keep changing it, and I don't know. We'll have to see what they come up with in the next few days, but right now what we're going to see is the rest of what I wanted to talk about tonight. So, today's item to sanitize and add to your high-touch list. Okay. I don't know if you guys have thought about this one. What is on my floor? Okay, nothing. Have you guys thought about your salt and pepper shakers being high-touch? If you're like me, I mean, I use salt and pepper pretty much every time I cook, unless I'm cooking something sweet. And even then, it's a little bit of salt sometimes. But these can get really funky and grimy, and people don't always think that these are high-touch areas, but they are. So, what I have here is, it's not actually the Comet Spray Gel. This is a diluted bleach cleaner for disinfectant, not cleaner, disinfectant, that I made. And I can teach you guys tomorrow how to properly dilute bleach. But I'm just going to clean these right quick while we're talking. And I wondered if you guys had thought of any other high-touch areas. You know, I had done a video a couple nights ago about that. You know, kind of go through your life for a day or two, see the different things that you're touching that you might not think about all the time. Like your glasses. Your glasses are almost a part of your face. So you might not even think, you might not even realize you're taking them on or taking them off and putting them on. Sunglasses, that's a big one. Your remotes, all your remotes, your devices, of course. Cell phones are filthy. So yeah, you want to clean that. Now just make sure, depending on the disinfectant that you're going to use, just make sure that it will not harm what you're using it on. So If it's your salt and pepper shakers, I know that this diluted bleach is fine. Rubbing alcohol, it can eat through inks on certain inks and on certain labels. So you can always test a little area just to make sure, but be careful. If rubbing alcohol is going to do that to the ink, it will spread. So even if you just put a little dot on one part, it will spread out. Okay. All shiny and clean. There we go. So that was today's item to sanitize and to add to your high touch list. One more thing, guys. I have an isopropyl alcohol hack, kind of, for you. So everybody went to the store and got their alcohol, right? Maybe you got a huge bottle of it. Maybe you got this size. It comes, you know, you can open it and you can squeeze it out. I'm sure you guys have figured that out by now. But it's not exactly easy to use if you want to spray it on something like this. I did talk several times about the little spray bottle that I've filled with some isopropyl alcohol. You can certainly do that, but I kind of, well, my better half kind of figured out a hack. So I went and I found a spray bottle that I had in the house. And this was the sprayer from it. And I took the sprayer off of this bottle. Oops. I took the lid off of the alcohol bottle. Now, not only does it make it so you can spray this alcohol to clean, but there's another benefit I'll tell you in a minute. So I tested the cap from the isopropyl alcohol bottle to see if it would fit on the bottle I just took the sprayer off. The threads did match. It did screw on. It's the same size. So all I did was put that sprayer on the rubbing alcohol bottle. So now, not only can I spray this to clean, if you got a fancy one, you can kind of adjust the stream, more spray, but it's already labeled. Remember when I told you when you put your isopropyl alcohol in a spray bottle to label it? Now you don't have to. If you have a spray bottle at home, you might want to try this hack. Now I did have to cut just a little bit off of the tube on the spray bottle, and let me show you something. The way that I figured out how much to cut. With most of them, you can probably just cut off the bottom, but if you can see, there's an area here that's kind of wider than the rest of the tube. So all I did was pull the tube out of the trigger, and I just got alcohol on myself because I'd already filled it. And then I just snipped a little bit off the top with scissors, and I put it back in, and I kept testing it in the bottle of isopropyl alcohol until it fit, because the tube was a little bit long when I first tried it. But the threads are the most important. If the threads match and it screws on, then you can always adjust the tube. So that is my isopropyl alcohol hack for you. I hope you find it useful. I hope you add your salt and pepper shakers to your high touch list and things needing of disinfection. That's really all I had today, guys. There were some questions that came in, but it's getting late, so I would like to log off, see if I can figure out what happened with Facebook. I don't know why it booted me in the first live. I hope that this second time I try to go live is working. I'm going to kind of play with it when I have some time and see what's going on with the live, the new live thing. But one more thing before I go. I will be back live again tomorrow. And I keep trying to do these earlier in the day, but it just never seems to work out. I'm so busy with other stuff that this seems to be the best time to do it. But I'm still working on that, guys, and I'll certainly update you when I know if I can do that or not. Speaking of dirty phones, might as well while I'm here, right? Might as well. All right, folks. I'm going to get going. Again, I want to thank you so much for all your kind messages. Not only about, how are you feeling? Are you sure it's a sinus infection and not COVID-19? Have you been exposed? All of that. It's so kind of you guys. But I also want to thank you for your lovely messages about what I'm doing with the live videos and the posts that I'm putting up. you know, I'm trying to do what I can to help. It's what I can do. I can't do a lot of stuff physically, so I can't volunteer that kind of stuff, but I do have some knowledge that seems to be coming in handy for lots of folks. So I appreciate it so much. And if you do have any questions, let me know. I'm going to try to put together some charts for tomorrow, just, you know, to make the numbers a little easier to digest. But for now, I am going to get going and start my antibiotics and get this sinus infection kicked to the curb before anything else comes to get me. So guys, have a great night. Stay healthy, stay safe. Please follow the precautions we're supposed to follow. Hand washing, sanitizing your hands, sanitizing surfaces. Don't go out if you don't need to. Especially in New York, it's the law. So if you're not essential, we really got to stop this thing from spreading so much. So have a good night, guys. I will see you tomorrow. And we'll talk more then. Good night, YouTube. Thanks for tuning in. We'll see you tomorrow night.